Well, thank you very much for joining us this afternoon. Today, I'm going to talk about something very important, how to survive a heart attack. As you know, heart attacks can happen to anyone, whether they're young or whether they're old, and even cardiologists themselves. So we have even treated some of our own colleagues with a heart attack. So before starting, I'm going to show you a video where this will actually summarize on how you should recognize the symptoms of a real heart.
It started out like a totally normal day.
Can we get to the next slide?
Mom! Okay, move objection deadline to the third line after survey. Oh, honey, for when you always use the verb estar. What are you doing down there? Did you finish your breakfast?
Yes,
Don't hit your brother. Honey, you have to eat something. Here. Okay, 5 minutes to carpool. Where's my coffee?
You okay, Mom?
Oh, I'm fine. Sandwich orders. What do you want?
Almond butter and jelly.
Spaghetti.
Oh, you sure you're okay?
I'm fine, sweetie.
I am so late. Hey, buddy, how you doing? Hey, honey. You okay?
Yeah, I'm fine.
You sure?
Oh, yeah. Here.
Acai, my favorite. See you guys later.
Where are your shoes? Put your shoes back on, please. You know, go help your sister. We're going in 3 minutes. Oh my God, what am I doing? I forgot to cut off the crust. Voila. Shoes on, potty if you need it. Honey, get your sister. Okay, here. Nobody move. I'm getting a dustpan. Whoa.
Mom! I think you're having a heart attack.
Honey, do I look like the type of person who has a heart attack? I'm just gonna sit down. I'm totally fine. Don't forget to wear the high socks with the shin guards.
Forget about the shin guards, Mom.
Come on, Mrs. Underdog is not gonna wait. Whoa. Okay. 9, 1, 1. Hi, sorry to bother you. I think I might be having a little heart attack. Nothing really, just some nausea, tightening of the jaw, dizziness, shortness of breath, muscle pain, achiness, this terrible pressure in my chest. Oh, really? They can be here in how long? 2 minutes. Can you make it 10? I thought I had gas. Turns out I was having a heart attack. Heart disease is the #1 killer of American women. So now I take care of my heart and I tell the women.
Yeah, so this is a short video, but it actually shows very important things. So you see this lady, she has classically all the signs of heart attacks, but it's very common for all of us to discount it because we always think, oh, maybe it's something else, maybe it's gastric problems. And the main thing is if the symptoms do not go away, you have to act on it. So if you look at the slides now, heart attack actually is a very common thing in Singapore. So we have about 31 cases per day. So that's a high number in the whole of Singapore. And 1 out of 10 patients, if don't manage them properly, they will have an increased chance of dying in 30 days after a heart attack in the vet. So in order to understand what actually happens in a heart attack, we need to know what actually happens in our arteries. So arteries are like tubes. So if you do a cross-section of the tubes, you will see a little ring like a circle. And when we are born, all our tubes are very clean, just like any pipe that is just bought off the shelves, very clean. And if you start eating junk food or you don't take care of yourself properly, a layer of cholesterol will start depositing inside the ring. And you see with time, more and more fat tissue gets deposited. And at some point, this is going to cause harm. So what actually happens is that actually there's a thin lining of a bit, almost like a skin that covers all this fat tissue inside this ring, like your arteries. And sometimes when blood flows over this thin layer, you can fragment the layer and you get a crack, what we call it erosion. And that is when what happens then is when blood is flowing through these cracks, they form a clot. And this clot that causes a heart attack. So if you look at this video now, if we play this video, you will see that this is blood flowing through. And suddenly you have a fracture of a plug of a cholesterol area. And that immediately creates a response. The blood starts to form a clot. If this clot can form really quickly, in a matter of minutes, you can have a blood clot that it clogs up the entire artery. And that's how an attack actually happens. So the heart is made of these tubes or arteries, and the arteries actually serve purposes of just how a river actually supplies water to a plantation. So if you look at the arteries, there are actually three major arteries in our heart. And what actually happens is that our body requires oxygen and nutrients from these arteries supply, just like how water is needed for the plantations to grow. So what happens is if you choke off this blood supply through a heart attack that I showed you earlier, the heart's going to withdraw. So here what happens, if you have no blood flow, it's just like no water to the plantations, all the plants will die. All the cells in the heart in the same manner will die. And what will happen is the heart becomes very weakened, and this is what we call end-stage heart failure. This is what happens when a heart attack is not treated early. So the outcome of a heart attack could be very dramatic. So a patient who have a heart attack because the clot now is forming and it blocks up the arteries totally, it can lead to what we call immediate danger or even death. So a patient typically will collapse. And if you don't react fast enough, or there's a person jumping into CPR or using one of these AEDs that you see a lot of these AEDs in the condos or in the flats, if you don't put this up enough and you don't shock the patient fast enough, you will lose the patient. In the setting of patients who are fortunate enough to sustain life and still be able to survive through, will reach the hospital. And if you don't get the arteries open quick enough, they will develop end-stage heart failure, which means they will always be short of breath. They have leg swelling and they'll feel fatigued all the time. So really to survive survive a heart attack, you need to recognize the symptoms. Just like in the video, if the little boy had already seen the mother have all these symptoms. So the first thing, recognize the symptoms. Number two, quickly call for help. And what is the easiest way? Call for the ambulance, 995. And the third thing is the ambulance has to get you to the hospital in the shortest time possible, because every 30 minutes delay means a 7.5% chance of dying. So to reiterate what the symptoms are, chest pain or discomfort is the most common, shortness of breath, upper body discomfort that can be even in the neck or the jaw, and sometimes associated nausea or lightheadedness. There will be some patients, especially in diabetics or patients who are, especially females as well, they may not present with the classic symptoms of heart attacks. So sometimes they can present with things like shoulder pain, back pain, abdominal pain, or even just dizziness. So if the symptoms don't go away, please look for a doctor for them to check you out. But we cannot be reacting to patients only when they get heart attacks, because that is really too late. So if that happens, we have a very short time interval to save this patient. So we really need to do better. So how do we do this? We need to do two things. We need to screen patients early, and we need to assess their risk. So risk assessment and screening are the two major tools that you can invest in to save yourself. So what are typical risks? A lot of you know this. Some people call it a sun cow or a three high. So you have high blood pressure, high cholesterol, and diabetes. Other risks would be things like smoking, family history, or increasing age. And one of the things that many people forget is also stress. So stress levels that are very high also is a risk factor for heart attacks. In Singapore, there's actually a very interesting calculator. So if you go to the internet and type out this thing called the Framingham Risk Score, the Singapore modified version, you can actually do a blood test with your GP and put your numbers or your variables into this computer, to the internet calculator, and it can give you a risk of what your current profile is and how likely are you going to get heart disease in 10 years. So this is just an example. For example, if you put your numbers in, your cholesterol levels, your family history and everything in, you will get what was called a point score. And if you look at the points, if you are Chinese, for example, and you have a 15 points, you have a 9% chance of having significant heart disease in 10 years. If you're Indian, that same number of points make you 19% more likely, because we know the Indian ethnicity creates a higher risk for developing coronary disease. So I'll give you some real life examples of patients that we have seen that we have kind of prevented the heart attack, these patients. So patient one is a businesswoman, very, very successful, super hyper. So every time doing something. And one day she told me she was feeling more short of breath during meetings and asked, could this just anxiety? And if you go a little bit more and do a blood test and screen her, we found out that her cholesterol is elevated. She had early diabetes, really does not exercise. And the second guy that we met also that prevented a heart attack was a banker. Again, very high stress work. He does exercise, but he's a foodie. So every day he's finding out nice places to eat. So he exercises very aggressively. He runs, but he still eats unhealthily. So he has risk as well. And when we evaluated him again, we could find a typical risk in the blood test. So one of the tests that you hear about is something called a stress test. A stress test is a treadmill test. And how a treadmill test is done is really, we hook up ECGs on the patient. We bring the patient to the lab, and it's a very simple test. There's no injections. We put you through a treadmill, literally, and we monitor how your heart behaves. So this guy is starting to run. The treadmill has essentially few stages. So every 3 minutes, it goes faster and faster and faster to create an increased heart rate and try to stress and see whether heart can cope. If the treadmill test, if you pass it, the probability of having blockage in the heart arteries is low. If you fail it, then the probability of having blockage is high. So this is something easy to do for many patients. More advanced testings are now available as well. So we have things like CT coronary angiogram, where you go into a CT scanner and you inject some contrast, and within like 15 minutes, you have a picture of the entire coronary artery, just like what you saw earlier on, the tubes. So the 3 tubes will all be clearly seen. Whether you have cholesterol in there or not, it will be very clearly obvious to you. What is most accurate in diagnosing or treating patients with established coronary artery disease and preventing a real heart attack is something called an angiogram or an angioplasty procedure. So here what you see is a patient who have already been diagnosed to have significant blockage in the heart arteries. And now we actually have to go in and try to treat this patient before they get a full-blown heart attack. So through the little artery in the hand, we put a little tube in and we did an X-ray to see. And you can see actually the blockage in the arteries. And in order to fix this blockage, we have to put in a balloon instead. So we put this very small catheter or tube into the patient's hands, and then we inflate the balloon. And these blockages are actually sometimes in the early stage very soft. They could be like plasticine. So you push it up, the blockage gets pushed to the side. Sometimes they could be calcified or harder. And then we have to do more work. And eventually a stent is put in to improve blood flow in these arteries. And so this is a real life example of what we actually see. So if you see these patients, they will have wires and tubes inside the arteries, and you see a little thing moving there. That is the balloon and the stent. And after you put in the stent, of course, the arteries are now restored. The blood flow is now better. This is the picture of the banker that we spoke about. On the top 3 pictures that you see, these are actually arteries that are very healthy. And the red line that you see now actually designates how a normal artery will be able to supply blood nicely to all the tissues to the heart. But in these patients, the red artery that you see is missing on the left. It is occluded on another artery. And on the right side, you see all these rings. These are all the spots that have blockages. So this patient has very, very extensive blockage. This is after eating a bak chor mee. So what happened? We can't do stents in these patients. They end up having a bypass, which is a good treatment as well, because this will last the patients for a long time. So by taking arteries from the hand or from the legs, they can bypass these blockages and improve flow to the heart. But can we do even better than traditional risk factors? I think we can. So this is actually the last slide for today. We take home. See your doctors early. Men more than 40 should be start screening. Women more than 50. Always start healthy, especially if you have young children. Start them with a healthy lifestyle early on so that it becomes habitual. Lab tests, the routine ones are easy to note. Now we know that there are also advanced cholesterol tests like Lp(a), which you can actually look for risk factors beyond the traditional risk factors. And we also have things like CHIP, which is the newest generation test for risk assessment. So if you do this test, you look at a mutation in the genes that's circulating in your blood and the cells, and that can tell you a risk of heart attacks, say, in the next 2 years. So we have a whole armamentarium of tools to prevent and to screen patients. And with doing that, you can prevent a very serious heart. So thank you very much for your attention.